Hello, welcome to World Diabetes Day 2022, and we are happy that you're joining us live or if you're watching this video, after this event. Welcome, to Nutrition Live Studio. All right, and on this episode, we have our able dietitian. We are really honored to have one of the few gentlemen who are doing amazing work in this profession in Nigeria. And this is the first time we are having him on the studio. His name is Okereke Dickson, and he's a registered dietitian, a practicing dietitian as well. Welcome to World Diabetes Day 2022, Mr. Dickson.
Thank you very much. Thank you very much.
Okay. So we have a lot of issues to discuss, okay, but we have to start somewhere. But before we go into it, International Diabetes Federation has some statistics, on diabetes, and they said for Africa we have about 24 million people who are diabetic, and in that figure they said 1 in every 22 adults are living with diabetes, and then the number is said to increase by 2045. Okay, the number is said to increase by 2045 by 129%, and we'll be having about 55 million people living with diabetes. Okay, and 1 in every 2 people, that's about 54%, are said to live with diabetes undiagnosed. Okay, and then 1 in every 8 live births are said to be affected by hyperglycemia during pregnancy. Okay, and then 416,000 people are said to have died through diabetes in 2021. These numbers are staggering. So I really want to ask, okay, how can we, okay, let's start. What is the actual cause of diabetes? Any form of diabetes at all, whether it is type 1 diabetes, whether it is type 2 diabetes, whether it is what's that one again that is caused by for pregnant mothers? Gestational diabetes. Yes, gestational diabetes. So what exactly is the cause of any of these diabetes? Okay, I would like to know, please, from a professional standpoint.
Okay, thank you very much once again for having me. It's my pleasure to join you for the very first time.
All right.
Nutrition Live. Yeah, thank you very much. Like you said, we have to keep it in a way that everyone will have to understand us. I will start from sorry, because sometimes you may see me looking like this. This is my window. Sometimes I may have some distractions, but I will not allow it to distract me. So, type 1 diabetes, which is commonly called insulin-dependent diabetes, is a kind of autoimmune disorder. I think my voice is coming out clearly. It's my wow.
Yeah,
can you hear me?
It's all right. It's all right. It's all right. Go ahead.
Am I audible enough? Am I audible enough? Okay. Confirm, please. Am I audible enough? All right. Should I remove this earpiece? Hello, confirm. Am I audible enough?
Yeah.
Okay. So this type 1 diabetes, which is insulin-dependent diabetes mellitus, is a kind of autoimmune disorder. Now, it is autoimmune disorder because somebody is born with it. It is something that the environment does not cause, like sorry that I'll be using illustration now. I had one patient some time ago. I had one patient. I had one patient some time ago.
We need more of the example since you're coming from the practicing point.
Okay. So the young man was a kind of lamenting in my office. He was sobbing anyway. He was telling me that if I know anything I should do it. That he doesn't want to die. Of course, nobody wants to die. So he had 2 kids, and he's in his early 30s or something like that. So he was asking a kind of a question whether he offended anybody to deserve this, or what his parents have done to deserve, maybe to give birth to him in this form and all that. So I was telling him that this is not something to blame, because his own was type 1. It's not something to blame himself. Neither is it something to blame his parents. This is not like genotype that you can decide to go into it even when you know you are not compatible. You can decide to go into it and damn the consequences. Some people do it. But in this case, it is something that the parents and he himself, who is the diabetic, are not to be blamed. None of them is to be blamed, because this is a kind of error that happens, I may call it error anyway, that happens maybe during embryogenesis and all that. So somebody, just nature that causes it. Maybe during formational stages, maybe if fetal formational stage, there may be a kind of attack in the pancreatic beta cells, which may now lead to the inability of somebody to produce insulin at all, or it may lead to drastic reduction in the quantity of insulin produced. That's why it is called insulin dependent, because insulin is a problem. So if insulin is produced, the problem will be solved. But because there is no insulin, which is the major hormone that evacuates glucose from the blood into the cells. So I was telling him that the best is now to learn how to live with it, because it has come. You are not to be blamed. Your parents are not to be blamed. Just let us learn how to live with it. So I will say, let me not downgrade. The question you asked me, the cause, major cause is damages or any damage at the pancreatic beta cells of an individual, because the pancreas is where this hormone insulin is produced. Even though the muscle can produce small quantity for its use, but the major place where insulin is being produced in the body is in the pancreas, in the beta cells of the pancreas. So if that beta cells are damaged, it means insulin production will not take place, and this person may have, we have diabetes. And that's why it is always being diagnosed early. And it is also called juvenile onset, okay, because it's always diagnosed early. It is something that always occur early in life. So, but some researches have also shown that these damages can also happen later in life, maybe as a result of maybe drug abuse, maybe environmental factors like drug abuse. Now, usage of some illicit drugs can actually find its way into the pancreas and damage the beta cells. And if the beta cells are damaged now, which means this same person who maybe was born without that error, that embryogenic error I talked about before, can now develop type 1 diabetes, even without that error by birth. Okay, so this one is another cause, but it's rare. In fact, generally type 1 generally is said to be rare, very, very rare. It's not common. In fact, in my
10%, I think it's 10% out of
good, 10% out of the entire 100% of diabetics. Yes, it's 10% about that. So throughout my stay here, I think I've met about 3 or 4 highest, 3 or 4 type 1. And the youngest among all of them was a young girl in children's ward was very close to less than 7 years. I think the mother said a month or some weeks before the girl will reach 7. So that was the youngest. So to show that it is rare. Why the other one, maybe type 2, which I am entering now, almost every day you see it. That one is very common, very, very common.
Yeah.
And people are not helping matters. Our people always, sorry to say this, there's this Igbo adage. They say that Nandi Igbo Sina na Ndi Igbo anaghị agba ọsọ mmiri until ọma zuo ha arụ, which means our people don't normally know how to make hair while the sun shines. It's very common among us. So people begin to pursue this when there are complications all over the place. But let me not digress. The type 2, when we go to type 2, in as much as type 1 is autoimmune disorder, type 2 is called non-insulin dependent diabetes mellitus. It can also be called adult onset because it normally surfaces during adulthood.
Early adult.
Most times. Early adult. Most times. And now, all these dietary habits, but as we age, there is if you're somebody who is not diabetic, as we age, there is always some physiological changes that take place in our lives. So that's why this type 2 tend to surface at adulthood. It may not be that it is that adulthood that person started abnormal habits or maybe some unwholesome habits, but because of these physiological changes, so it will now tend to be prominent at that stage. Now, type 2 is a typical metabolic disorder that is commonly caused by insulin resistance. There are some few things that cause it, but major cause is insulin resistance. Now, normally, when we eat food, especially the carbohydrate foods, the starch content of those carbohydrate foods will be converted to glucose at the end of the day, because that is what the body knows. This glucose, which will find its way into the bloodstream, will begin to be drawn into the cells. That's what we call assimilation. Each cells, just like how magnet attracts metallic objects, So these cells begin to attract these sugars into them. I want to keep it, in a very understandable level. The cells, just understand the cells as the magnet, as the magnet. Then understand the glucose as the magnetic material, as the metallic material. So the cells will be attracting it. But the fuel that possibilize this thing, this activity, is insulin. You see, it's insulin. Now, any cell that gets fed up, we now lock up that pathway. That assimilation will no longer be taking place. It will be using the one it has taken until when it needs another one. This is what happens in normal non-diabetic persons. Now, okay, so now, when somebody is constantly bombarding the system with high carb diets, maybe overeating, assuming now that what your body needs for both all the physiological activities, whether you are off. You are off. Are you there? Are you there? Your network is going down. Reconnecting. Okay, maybe I will continue. Maybe you join me.
Sorry, keep going. Yeah, sorry, go ahead.
Okay, I just paused because I didn't see you again.
Go ahead.
Okay, so when I don't where I reached is when each of the cells get fed up, they will lock up.
Okay.
They'll just lock up and stop for the assimilation until when they need more. Now, but when
Yeah.
somebody constantly bombards the system with high carb diets, or maybe overeating, or maybe refined foods, especially refined carbohydrates, it means that
Yeah.
you are giving this system more work than it can handle. It will keep on doing this thing until one day it will begin to reject the cells will begin to reject that assimilation that normally take place. So
Yeah.
it means that in this case, that insulin that is doing the work of evacuation
Yeah.
of glucose will now
Yeah.
be much in the bloodstream. Then glucose itself,
Yeah.
which the insulin is supposed to be evacuating, will equally be much in the bloodstream. That is
Okay.
hyperinsulinemia. That is, the insulin will be much there. The cells will be resisting further assimilation of glucose, which means the insulin that is actually doing the work of evacuation will equally be much in the bloodstream. So in that case, there is insulin resistance in that case, which means most of these things you are consuming will end
Yeah.
up in the bloodstream. They will end up in the bloodstream. And the truth is that the sugar
Yeah.
from this food we consume, they have stipulated number of time they're supposed to spend in the bloodstream. Then they live there. That's the right thing. But when they stay there and they overstay their welcome in that place, they'll begin to cause one or two
Okay.
damages. That's just the truth. So for type 2, it was not good. For type 2, major cause is insulin resistance. That's the major cause. And all these things I'm trying to explain is what can actually
Okay.
cause this insulin resistance. Excess carb intake can actually cause it. You need your body actually need maybe one plate. You are eating 10, you are eating 5. You do it in the morning. That of morning has not been metabolized totally. Before you know it, you put another one maybe in the afternoon or mid-afternoon. In the evening, you put another one. And all of them more than what you actually require. So when the body just handle it one or two times, before you know it, you begin to reject it. And when that rejection starts, both the glucose will be high, insulin that is actually needed for the evacuation will equally be high. All of them will pile up in the bloodstream, and you will now have insulin resistance. So in that case, we may not say that that person is diabetic in that particular point in time, but
Okay.
you can say that that person is hyperglycemic. Actually, the blood sugar is high, but when that hyperglycemia is sustained, when it is
Positive.
sustained, we can now rightly say that somebody is diabetic. Uh-huh. Just like high blood pressure and hypertension. So they are not actually, they are close, but not actually the same thing. So the main thing there is insulin resistance. But there are one or two other predisposing factors, like obesity. We can't talk diabetes without talking obesity, talking about obesity or overweight, rather, because that may be the way that people want to hear. Because when we talk about obesity,
Yeah.
I don't know how it sounds in the ear of people. It sounds more diseased, more than when you mention overweight.
Yeah.
So somebody was asking me sometime, this was overweight. I hope it has not entered obesity. So the person asking you may think the person actually know what obesity is, but how it sounds, they think that when it enters obesity, that one is disease,
Yeah.
is threat that kills someone. But all of them is what we know is overweight, extreme level of
Okay.
overweight and all that.
Okay.
So obesity is another
Okay.
one. So
Okay.
let me touch a bit. Though there is nothing much
Yeah.
in the
On
GDM.
gestational,
GDM,
I think.
yes,
Yeah.
gestational
Yes.
diabetes.
Yes.
Gestational
Yeah.
diabetes is commonly, seen among some pregnant women. It is similar. to type 2. In fact, it's a kind of type 2. It's not type 1.
Okay.
It's a kind of type 2. But
Okay.
many clinicians believe that they don't know the actual cause. Okay? Because some people will be pregnant, they will have GDM, while some will be pregnant, they will not have it. But some researches that are on ground has actually proved that people born with high birth weight are most likely to be predisposed to GDM when they conceive. Okay, and again, stress management. You know, when a woman conceives, there is a kind of disarray of hormone. You know, a whole lot of disarray of hormone, and this disarray of hormone now, which you know that actually causes something like craving and all that, which somebody under normal circumstances cannot crave for such. But because of pregnancy, the person will begin to crave for such. What actually causes it is just hormonal disarray. Okay, so this hormonal disarray now is one of the things that they are also pointing. Something like stress. You know, a woman that is pregnant psychologically is not the same way that that same woman was before pregnancy. Okay, and you know that stress is one of the factors that actually worsen or even increase blood glucose.
Yeah.
Like this cortisol, for instance, when you are stressed, now when you have emotional stress, or when you have any kind of stress, the body will always interpret it as emotional stress. Yes. So what emotional stress does is to increase blood cortisol. And when the blood cortisol, which is actually produced by the kidneys, I think, yes, the kidneys. So when the blood cortisol is increased, what it does mainly is to increase the blood glucose. Yes, among other things it does. So I want to come in this point that when a woman conceives, you know, sometimes now, some of us that are married, who you don't handle them how you handle them when they were not pregnant. Even some of the things you normally say before, and it will not be a problem. You may say it now, and somebody may flare up. That person flaring up is not flaring up because you have actually provoked her, but the person is transferring aggression, maybe what she's passing through to you. So, which means, yes, because of the stress. So, some of the scientists are now pointing at that stress that is actually, or that actually accompanies pregnancy as one of the factors we may be looking at, that may be one of the causes. But on the whole, the causes is not actually. Then others, let me not I remember, others are also pointing at, but this one I think there is no much work done here.
Okay.
You know, this amniotic fluid, amniotic sac rather.
Yeah.
Now they are saying that people that have how will I put it, higher size of amniotic sac are more prone to GDM. But I don't know their proof. I don't know their proof. But these are some of the things that some scientists believe.
Still at developmental stage, I guess.
Yes,
the study.
Because we need to know. We need to know what is the relationship, the correlation between amniotic sac size, or even the content, as the case may be, and the GDM. But we may not rule it out that it's not because this is actually reproductive physiology.
Yes. All right.
Thank you very much.
I guess type 1 is caused by nature, it's genetic.
Yes.
And then type 2 is caused by insulin insensitivity. Then, insulin resistance. Yes. And then gestational diabetes is also caused by the stress hormones, that disrupts the action of insulin, right? Okay, so I'd like us to go quickly into the next question, which has to do with the diagnosis. From the statistics of IDF, they said 1 in every 2%, or 1 in every 2 persons that are diabetic are undiagnosed. One, I would like to know, what do you think is the problem that people are not being diagnosed? Is it because of the cost of diagnosis? Is it ignorance? And then how do we diagnose it that people are not being diagnosed? What exactly, how do people get to diagnose that they are diabetic? I'd like to know. Is it something that they read online? Is it when they see certain symptoms, they just assume that they are diabetic? Or is it something that their grandfather would tell them, or their friends should tell them, okay, once you have this thing, you're diabetic? How do they need to diagnose diabetes?
Okay, thank you very much. I think the question is into two here: diagnosis,
Yeah.
right, and why, because some
Why are people
percentages are
not
not
being
diagnosed.
diagnosed? Yes.
Yes. Like in Nigeria, in the prevalence in Nigeria, they are quoting about 6 million persons, okay, are diabetic, and in this 6 million, which they are predicting that in about 2030, it's expected to double. But my issue here is that they said two-third of that number is yet undiagnosed. Like the same thing you now said, two-third of
Yeah.
it, of that number, is not
Yeah.
diagnosed. And personally, from my little experience, I may even say that they are being economical in that number, assuming that figure is correct. That 6 million is correct. They are being economical by saying it is two-thirds of that number. It's supposed to be more, from my little experience. Now, in our facility, majority of the people that have been diagnosed of diabetes here,
Yeah.
they normally come to hospital for another thing. Majority, they normally come to hospital for a different thing altogether. And all of a sudden, some of them will be diagnosed maybe during lab tests.
Okay.
The sugar result may even be more than what that machine can read. Maybe using a check or any of these glucometer. It may read high, more than 600 milligram per year. So in that case now, the person will be admitted. But this is somebody that came to hospital for a different thing altogether. Majority, I'm telling you. Then while some others, we go to farm. They go to farm, maybe have one or two injury. The injury will refuse to heal. They will treat it locally in the house for some years, for up to 1 year or thereabout, until it will enter gangrene. The foot ulcer will enter gangrene, where they will come to hospital. They may be saying it's juju or all this stuff, you know. So when it must have entered gangrene, take them to hospital and all that, and they will be diagnosed of that. And you know, before there will be ulceration like that, it must have lasted. Are you seeing that? It must have lasted. You can't have diabetes just today or tomorrow, and the person will begin to have ulcer. No, foot ulcer, diabetic foot ulcer. It's not possible. So, which means that this person must have lived with diabetes for some years, as the case may be, without knowing it. So, in this case, I will say that it's not just because of the economy, although we may not rule out completely economy, socio-economic status of people, but ignorance. I think ignorance plays major role here. Ignorance plays major role here. And some people now, when they have maybe foot ulceration, they have this belief that once you go to hospital, they talk about cutting. That fear alone will begin to, dissuade them, yes, from going to hospital. Because once you go to hospital, there is nothing they do in the hospital that cutting the leg off. So that one is a factor. But this ignorance now, for somebody to have injury, and this injury refuses to heal, because there is ignorance, the person cannot actually, suspect anything. Because had it been there is no ignorance, this person can quickly, although in this case I will not say ignorance, I will say education in this aspect. This aspect.
Level of education.
Level of education. Okay? Because there are some, I've had one person now, a lady, she was frying oil, something of that nature. That oil suddenly splashed. All these kitchen minor hazards. It splashed and burnt off just a minor first degree burn, burnt off the surface, part of the hands and all that. So normally now, you're supposed to, maybe after she deflated that because there was no scar. After deflating that place now, it's supposed to heal maybe after a few weeks. But the thing started misbehaving. Okay. So because the woman is a bit enlightened, I think she was a teacher, like she told me. So after the wound started misbehaving, nobody told her. She suspected, because one of the things I will say here, in case I forget it, people should know their body. Our body speaks. Our body speaks. But sometimes, because of being too busy, yes, and insensitivity, thank you very much, people don't tend to listen to their body. Because if you actually listen to your body, when your body begins to speak a different language, you will know that this is not normal. This is not what your body normally do. So this woman now was able to understand that her normal body, just little thing like this, it doesn't take time to heal. And this is just little splash from oil, and they started turning to another thing. So nobody advised her, because she had, because of her level of education, she was able to come to hospital. And after lab tests, the diabetes was there now. So that was how we started managing it. So, but in the area of what again did you ask? Diagnosis, right? Diagnosis.
How do you diagnose it? Yeah. How do you need to? Yeah.
Basically, as a dietitian,
is it the doctor that diagnoses?
Yes, that's what I'm saying now. As dietitian now.
Can you hear me?
Yes, I can hear you.
Okay.
I can hear you very well. So it is the doctor that diagnoses. Yes, I am trying to say that as a dietitian, what we do is, if patients are referred to us, then we use the laboratory test. The laboratory test is what, not because the doctor said it is or not, but the laboratory test, which the doctor usually recommends. When they bring it, we interpret in our own way and analyze it. And if it is maybe fasting blood glucose, blood sugar, or random blood sugar, which I normally recommend patients to go and they run this glycated hemoglobin, or call it glycosylated, anyhow you want to put it. So I prefer that one, because that one predicts somebody's blood sugar.
It gives
at least past 2 years, past 2 months, rather. Unlike the other one, something like fasting now, I've seen such case. For instance, now if it is somebody who is routinely, taking night meal late, for instance, maybe in the night now, you go and take your supper by that kind of, let's say 10, 11 or thereabout, and go and sleep. At the early morning you wake up, you want to go to market. If you take your fasting blood sugar, it must be wrong. Okay, and you may see that this is 300 milligram per dl, but actually that 300 milligram per dl is not actually what it is. It's supposed to be less than that. Just your habit yesterday is what affected it. So that's why I prefer that glycated hemoglobin more than glycosylated, anyhow you put it, more than. But not as if that fasting and the random are not okay. They are also good. So in essence, we use laboratory test, basically. Then secondly, we use clinical science and symptoms. Maybe we may call it in our own field, we may call it nutrition-focused physical findings. Some of them, it may be
physical science.
So, yes, nutrition-focused physical findings. So it is part of the clinical science. So, for instance, now maybe somebody is it boils down to what I said earlier: listening to your body when your body speaks. But no matter how busy we are, we're supposed to be very sensitive to the language of our bodies. Our bodies, they speak. So if maybe, for instance, you started urinating faster than, more frequently than you normally do, if you are not careful, you may not know. But if you are careful, you will know. You will know. So that one is also a sign. That is polyuria or nocturia, maybe in the night. You discover that in the night you urinate many times. In the day, it will normalize. So it is also like that. So, but these ones now may not come immediately. Maybe somebody have a hyperglycemia now, it may not surface immediately. Another one which I normally use frequently is weakness, abnormal weakness. Okay, I think that one works better, because if you're talking about this polyuria, the diabetes must have taken a while for that sign may come in. But something like weakness. Yes, this abnormal weakness, unlike how you used to behave before. Because normally, when you eat food now, let me still explain it again. After digestion and absorption takes place, it enters into the bloodstream. The cells will begin to pick glucose for energy. That's normal thing that happens. And each of those cells have a work. Out of the billions of cells, each of them have the work they do. And that work they will do, they will use that glucose, the energy that will come from it is what they will use to work. And they don't take overdose. They don't behave like human beings that maybe somebody may say, just one bottle of alcohol that I will drink, or because he's buying it with his money. When he goes where it is free, he may order one crate because it is free. So our body doesn't behave like that. They take exactly what they need. The next, anything that is remaining is for storage. That's how, so that's how they behave. Now, the analysis I'm trying to make here is that in a normal person, let me not use the word normal person because everybody is normal. In non-diabetic person, non-diabetic person, whenever this glucose finds its way into the bloodstream, the cells begin to pick them and use them. So, and the brain takes the lion's share of the glucose in the body, takes the lion's share, about 50% or thereabout, consumes highest, followed by internal organs like kidney, heart, pancreas, and all that. Then for the skeletal muscles and muscular system. So as they take all these things and use, all this glucose and use, as they are using it, when there is depletion, when it starts going down a bit, brain will send that hunger message. That hunger message is for you to know that you need to refill. Then if you act based on that hunger message, you now find something and eat, and the cycle will continue. But when somebody is diabetic, when these sugars are available in the bloodstream, the body of a diabetic person doesn't have 100% access to blood sugar, to sugar in the blood anytime it wants. There is a trapping, let me use the word trapping, of sugar molecules, even when the body needs it. That's why somebody's blood sugar will be very high, in a diabetic person, but this person is still hungry. The analysis I normally use for my patient is somebody that has a shelf in the house where you put money, lock it up, and you lost the key. And I come to you, give me money, I need this money. No. You can't give me because you don't have access to it. If you like, have billions inside the shelf. You don't have access to it. Only you know that you have money.
Or somebody that has money in his account and has lost the ATM card.
Okay, very good. A very good example is this one. So that's the analogy. That's the same thing that happens here. So this person has excess sugar, but the body cannot access it. It's a problem already. So because of that, when the body wants to access it and the body doesn't have access to it, brain will interpret it that you don't have sugar. The same way to interpret it in somebody who is non-diabetic, who is going hypo somehow. Okay, so that is the same way to interpret it, causing you to go and feed more. And in that case now, because your body doesn't have access to this sugar in the blood, that weakness will be felt. You begin to be weak. That's why I say that I prefer this weakness, this sign of weakness, because it is always faster.
It's
not
often,
like the other ones.
Yeah.
It's often, yes. Not like the other ones. So if you are using other ones, just like saying that, okay, let us use a nephropathy, or let us use a neuropathy. As that one will happen later, maybe after some years. Okay, so I prefer using this weakness. It's one of the signs. So the two things I've mentioned here is lab tests, use laboratory tests, which will be run by laboratory scientists, maybe interpreted by the consultant there. If whether it's brought to us, they will interpret the laboratory tests and be able to use them to do one or two things. The second thing is clinical signs and symptoms. These are the two things basically that we use now.
Okay. Thank you very much. As a dietitian, okay, who is in the field, all right, what do you think is the reason why people are struggling with controlling their blood sugar? Okay, because I see even in where I work, okay, we have a community where we help people to control their blood sugar. I see a lot of people struggle with that. What do you think is the reason why people are struggling with controlling their blood sugar in order to avoid complications? All right. So, what are the things you've observed in your little years of experience, that is making people struggle with, controlling their blood sugar?
Okay. First of all, I may sound a bit selfish this time.
Okay.
People find it difficult. Let me use the word difficult to see their dietitians. It's a factor. People think that they don't take dietetics very seriously, especially in Africa, maybe in Nigeria. Because in the Western world, people has gone beyond. In fact, you can't go to hospital without, instead, you will not even see your doctor. I'm telling you what I know. But here, that's why sometimes they classify all of us as doctors. Even when you tell them I'm a dietitian, they will tell you, leave that thing. It's something. What they see dietitian as is just an area of specialization in medicine. That's what ordinary people here, where I am. Like you have endocrinologists, you have gastrologist or gastroenterologist and all that. That's how they see the dietitian. So when they come down here, maybe they see one or two doctors, they will go. And some people look at money. If they come to hospital now, after having the first contact with the first doctor, diagnosis has been made now, and the person will be given drugs, maybe glucophage, metformin, Thionyl, as the case may be. The person may think, I have diabetes and drug for it has been given to me. Why am I going to waste that consultation fee from the dietitian? It's a factor as well. I'm telling you, because some people sometimes, when doctor actually repel them, when they come out from doctor's office, they will use the gate instead of coming to the office. Maybe in subsequent visitation, they may even miss one appointment. Maybe they give them 2 weeks to come back. They may miss the appointment. Maybe after a month or a month plus, they come back. maybe the sugar was, let's say, maybe 8.5 millimole per liter, for instance. It will now enter 10 point something. Instead of going down, coming up. Then the doctor may now frown at the patient. That is when they will come. When you check the date, you begin to see it was maybe last month or last 2 months or last 3 months that doctor referred this person. And you begin to ask him or her, but you were referred so why? Just use 1 or 2 things to cover up what this is what I know that they normally do. Why did they now come? Had it been the thing is even stagnant within that same 8.5, which is not normal, they may not come. Had it been maybe it reduced from 8.5 to just 8, which is not also normal after 1 month, they may still not come because for them there is a little progress. But because it wasn't this state, and again, doctor frowned at the person, they now decided to come. So negligence is one of the reason here. You know? So people supposed to be seeing their dietitians often at home, because all these things we talk about, you hear dietary adjustment, this and that, you may not get actual information. Though I will go to that later, but all these social media, print media, I may go to that later. That you may not get actual information in those places without actually seeing a professional who will guide you. You know, for instance, there is one. I don't want to sound ecclesiastical, but there's one statement in the Bible where somebody was asked whether he understands what he was reading. He said, "How can I, unless somebody is guiding me?" So all this information, maybe they carry their phone. I have a patient, sorry to digress more, I have a patient that has a serious hypertension. This one is hypertension plus 1 or 2 other issues. But this patient now, the major thing we do is assurance. Assurance. That's the major thing. The information that the man was digging was even what was causing his problem. He doesn't sleep. Even all the drugs they give him, all these sedation drugs and all that, he will even abuse it. He used to tell me, hey man, he will even abuse the drug. When they say take 1, he will take 2. He will abuse it and still he will be awake like this until morning. It's a fault too. It's a serious problem. Normal sleep that you and I will go to bed with those off. This young man will be awake all night. Not that he will sleep small, awake all night. I told him this thing now is what is even worsening, because this your inability to sleep is not good for your sugar level. It's not even good for the hypertension itself. And the thing is worsening. So do you know what is helping now? It's just because I dug deep to find out that his problem is information he's getting from social media. That is where his problem is coming from. Because for instance now, if you take your fear. Not fear. If you take your phone now and type maybe you are having maybe headache, what could be your medical problem? For instance, you will see everything. You will suffer from everything. You will suffer from everything. So, and for somebody who is not a professional now, when you get such information, in fact, according to him, sometimes he will carry his phone like this, until he will forget himself. His wife, in fact, to some extent, I told him to call his wife in my office. He called the wife. I spoke with the wife in the office. The wife confirmed, though she was very happy, but she confirmed that she'd been trying. I told her, I also praised her that she's trying, but she should try more. But the problem of the husband is stress. That's the major problem now. And he opened up to me, because of all these things that I said, he opened up to me that he had a consultant somewhere. He's also a cardiologist that is also chatting privately. That what I said is similar. That's why he used to be very free with me. It's very similar with what the cardiologist told him. But the difference is that the cardiologist doesn't attend to him. If he chats me now, whether I'm less busy, I will reply. But the cardiologist, if he chats him and he sees that there is no problem there, he will not reply. He only replies, I was the one that found out that that was what was happening. But he was thinking that the man, wasn't, replying his messages. He told him that your problem is worry. Because it was when I told him your problem is worry that he brought out the chat, the WhatsApp chat, and showed me what the cardiologist, a consultant, told him.
Yeah.
His problem is worry. So what I'm saying here is that people should learn how to see professionals for information. This is health. We are not talking about, it's not one gambling somewhere. People should not gamble with their lives. See, it's not when people are diabetic that's supposed to see dietitians. If you go to hospital, how much will it cost? You go and see a dietitian. The dietitian will put you in order. Remember that diabetes doesn't happen one day. It doesn't happen one day. It's a progressive stuff. Yes. Until when it reaches that threshold, it is looking at, it will strike. So it is something that if somebody start from day one, taking care of one or two things, you may either, if it is genetic, you may either run away from it or you may even delay it. If it is genetic, if it is something that is definitely going to come, you will delay it. So number one is seeing dietitians. That's the most important thing there, seeing dietitians. It is very, very important. Then the second thing there is physical activity. Remember, we're talking about why people struggle to prevent this. Now, I had, or let me say I still have, because we've not finished. I still have this patient, he will still come. And the next month is his appointment. He's a banker, and this is where I have problem. Bankers now, from their house, they enter into vehicle, enter into the office, stay under AC, where they are, even reduce their biochemical activities and all that. After that, they enter into vehicle and come back. The only major stress they have is all mental stress. Balancing of check and all that, balancing of account or whatever they call it. Okay, because I've had some friends now. I know that sometimes they may try to balance a particular account, maybe a transaction for the day, and it may not balance until even up to 5. They will keep it there, go back to home, come back to the office as early as 6 tomorrow to finish it, to balance it before they start the work for the day. So, but if it is physical activity, increased physical activity, they don't have it. They don't have it. So, and in that mental stress now, it's not part of physical activity. Your internal organs don't enjoy it. Okay? So, what it may now cause, if it is somebody who is already diabetic, what it may now lead to is increased cortisol, which may even be worsening the blood sugar.
Sensitivity.
So, yes. So, what I'm saying in essence here is that people should increase their physical activity level. Is important because apart from intentional physical activity increase is very important, because apart from all this idea of burning of maybe exciting adipocytes to increase maybe burning of fatty materials and all. Apart from that, when you exercise muscle tissue, when you increase the activity of muscle tissue, you increase how efficient that particular muscle tissue will use glucose. It's just scientific. What it means is that if your body can use, let's say, let me be just example now, can use, let's say, 10 molecules of glucose, just an example, when you are sitting in one place. If you exercise your muscle can now use more than that 10. We use 15, we use more than that. That is what it means. So exercised muscle tissue uses glucose better. Just scientific. So physical activity is important. And one other thing, before I forget, when we mention exercise, some people may think that Exercise just you pick one day, you want to run everywhere. That is not exercise. That is not exercise. You may even end up straining the muscles and all that. If you do, maybe you are starting exercise now, you do heavy exercise the first day, your body will react the same way it will react when you have accident. That is how it will react to repair those tissues, not actually using that exercise for any beneficial effect. So what exercise needs is consistency. That is the most important thing. Consistency. No matter how
consistency needs to be there.
Consistency is very important. Maybe the first day you did it, your body may not use it for anything. Maybe the second day may be the day it may understand it and use it as part of its function. It is only when the body uses it as part of its function before you begin to gain the benefit from there. It's just like addiction. You know, when you say that somebody is addicted to drug, it's not the first day that that person takes that drug that addiction comes in. It is when the body now begin to depend on it, begin to use it as part of its function. So if you don't put it, it will demand it from you. So in that case, it is using it as part of the function. So exercise should be, regular, consistent, not just destroying yourself one day in the name of exercise. Just little by little is the most important thing. If it is maybe once in a week or 2 times in a week, maintain it. Just maintain it so that the body will now see that this is what you normally do.
Although the standard, according to what they say, is 30 minutes in about 4 to 5 days in a week. So let's just say, so that if people want to go into it and they have the time, there's no harm in doing what is necessary.
No, there is no harm. There's no harm in doing it too much. What I'm saying is, the first day you want to start, don't go and do everything. You go and relax.
Okay.
Little by little, just be doing it. And again, it boils down to seeing. Yes, it boils down to seeing a professional that I talked about. Maybe seeing a dietitian or maybe seeing a clinician. Because, for instance, now we know that exercise is beneficial, but when somebody has maybe cardiac disease, for instance, or heart-related issue, then there will be adjustment. They will not be allowed through exercise, as the case may be. So it is somebody who is a specialist that will know how to advise you well. If somebody who has maybe congestive cardiac failure or something like that, or any of the cardiac diseases, you will not utilize exercise the same way somebody who doesn't have utilizes exercise. Okay, so that's why I said, or maybe somebody who is on a antiretroviral treatment or something like that. So that's why I still maintain that it is better to see your clinician, to see your dietitian,
or a medical rehab.
Guide.
Yes.
Guided. Then there are many things under here, but maybe when it is time you tell me, I will stop. Fiber
go
intake
ahead.
is another
Maybe
thing.
let's run through it. Maybe run through it so that
Okay. Now, people by right, people are supposed to optimize their fiber intake. Okay. Optimizing fiber intake controls sugar, just natural in everybody. If you eat maybe 1 cup of rice, of course, the surest source of fiber in this part of the world is vegetables. That's why, apart from other nutrient contents, minerals, vitamins, and all that. So when it comes to diabetic management, we normally encourage enough vegetable intake or vegetables intake. So the reason is mainly for fiber. Fiber is the major reason, among other reasons. So now, when you take, maybe you consume a particular plate of rice without any vegetable, then you consume the same quantity again with some vegetable addition. That quantity, even though it's the same quantity, you will get more sugar at the end of the day, that one you consume without vegetables, than the one you consume with vegetables. What fiber does is restricting. This one happens in the gastrointestinal tract. Restricting free entrance of free sugar, free glucose into the blood. Fiber restricts it. It doesn't allow free entrance. Maybe anytime they want to enter, they enter freely. It doesn't. I know that body factors is there as well, you know. So, but this is what fiber does. So, if one can optimize fiber intake, maybe learn to regularly be using, maybe taking vegetables. I've seen people that say they hate vegetables. They don't take vegetable, but they consume all this stuff. You know. So people are like that. If there is any, if you don't like, that's why there are various kinds of vegetables. If you don't like this one, you may like this one. If you don't like this, you may like this. At least all of them contain some appreciable quantity of fibers and all that. Then there are some other sources like oat. Oat contains some fibers. When we come to swallow, that's why I still talk about seeing dietitians. When you come to swallow, your dietitian will now know maybe what to recommend. Maybe when you must have discussed with him or her, the person will now know your preferences and all that. If within your preferences there are things that are okay or that could be combined, then go ahead, because you don't just withdraw entirely what somebody is used to, unless if it is inevitable. You can go ahead and withdraw and restrict the person. So fiber is
I would like you to, yes, I want us to talk about the swallow now. Okay. The best.
I can't hear you. I can't hear you.
Okay.
It is having an audio problem from your side.
Yeah.
Can you hear me now? Can you hear me?
Okay.
I can't hear you very well.
Okay.
Repeat your question, please.
Okay.
Wow, there is a network problem here. I can't hear you.
Hello, can you hear me?
Yeah, I can hear you now. Repeat what you asked before, please.
I can hear you, but your video is breaking. I don't know if mine is breaking.
Yours is yours is freezing. Yours is freezing. Wow. I don't know whether I will continue. Okay, anyway, let me continue before you come in. Let me mention one or two other things. So another thing will be being very selective of your carb intake, or let's say cutting down carb intake. Maybe you go for foods that are low in glycemic index. Okay, you went off. I said, let me not wait. Let me be saying one or two things. Okay, I was saying something about cutting down.
Keep the audience.
Cutting down on carb intake.
Go ahead.
Okay, cutting down carb intake. On carbohydrate intake. They used to say carbohydrate intake. So if by right, if possible, people should go for foods that have a low glycemic index. You know, most times we talk about calorie, but there are some foods. Two foods may have same calorie, but one may have higher glycemic index than the other. So because they have same quantity of calorie, they are not the same thing. So that one that has lower glycemic index. When I say glycemic index, I mean how fast any particular
breaks down.
Yes, food you eat can raise your sugar level. So those ones that raise the sugar level very speedily, they are not okay. They are not accepted. They are not good. So we prefer those ones that will be raising it small, small, so that as sugar is entering into the blood, the body will have time to utilize it. So another one will come in. Not all of them, migrating into the blood, and overwhelm everywhere. So low glycemic index foods is better, or at most you use medium glycemic. Medium glycemic.
Okay.
So that
Thank you. Thank you for that. I think we'll leave it at that. I have a last question.
There are one or two other things.
Yeah, I'd like to ask a final question. The reason why our theme for this year is, access to diabetic education. Okay, access to diabetic.
Yes.
Education diabetics, right? So I want to know, do you think that people that are diabetic, they have enough access to diabetes education? Because I know that even in the Western world, can you hear me?
Yes, can you hear me now?
Yeah, I can hear you. So
let me change. Sorry, wait a bit. Let me change my network. I don't know whether my data is
okay.
No. Let me change my network.
All right, go ahead. So while we wait for him, I guess he mentioned a couple of things while he was speaking. The reason why we have, people are struggling with their diabetes. I guess you are listening and you're following up keenly. Yeah, I can hear you. Welcome back. So I was about asking, in the Western world, there are people who are known as diabetes educator, right? And these people, some of them are dietitians, some of them are not dietitians. And what they do is just to help diabetic people to know about the condition and what they need to do, right? So I'm asking, do you think in this part of the world we have people are aware of what they are suffering from, okay? And do they have access to these informations? And what exactly is the reason? Is it that the professionals, we are not doing our part, or that people are not really asking, asking the right questions to people that need to answer them, or what exactly is the problem?
Okay. Thank you very much.
Hello, can you hear me?
Personally, yeah, I can hear you. I got your question. Personally, I think but many things are involved here. Yeah, I can hear you. Am I coming out clearly?
Hello, can you hear me?
Yes, very clear, very loud and clear. Can you hear me too? Can you hear me? Wow. Wow. Okay. Maybe I should continue. Maybe I should continue. Before he comes in, let me continue. Personally, I believe that people have access to some pieces of, but
can you hear me?
They have access to. They don't have access to. Let me say they have access to a lot of wrong information. A lot of wrong information.
Okay.
So, okay, welcome back.
Yeah, can you hear me now?
Back. Yeah. Yes, I can.
Okay, go ahead.
So I
You
was
got my
saying,
question.
that
Yeah.
yes, why people, whether people have access to to right information or what. So personally, I believe that people have access to a lot of wrong information.
Okay.
Is my personal belief. People have access to a lot of wrong information. And mind you, quackery has been a problem in the health sector, especially in Nigeria. Okay,
Okay.
there are
Okay.
a whole lot of people that are posing as health professionals when they are not. I think that middle this year, there was one group I
Yeah.
saw where somebody was giving diploma certificates in medicine in Lagos.
Mm.
Was
Okay.
giving diploma certificates to people. So
Okay.
you just come and maybe serve him in form of apprenticeship or something, not even in school, for a few months, 6 months or thereabout. He'll give you
Yeah.
certificate, diploma in medicine, you become a doctor. But the person issuing those
Yeah.
things is not actually a doctor. I think he's a pharmacist or something. So what is the problem? It has been a problem in health sector in Nigeria. And all these so-called quacks, either in dietetics, medicine and surgery, in physiotherapy, med lab, or in any of the health fields, all these people, they have one or two persons they cancel. Are you getting what I'm
Yeah.
saying? So, and
Yeah.
there is a natural law that you can't give what you don't have. So
Yeah.
when these people come across them, they
Mm-hmm.
dish out those pieces of information that are not correct. And those people will swallow it, hook, line, and sinker, and
Yeah.
act based on that. So that is misinformation instead of information. Now,
So
in the
so
place where I
what do we
am,
do? What do we do to tackle this particular problem? Is it for professionals to, since the social media is where these informations are gotten easily, do we say let people just come, and if they are not coming, do we still wait for them, or we should do as much as we can, to reach out to them via the social media or online?
yes, somehow you have answered the question now. You have answered the question. Somehow, what we are doing
Okay.
now is exactly what is supposed to be doing.
Okay.
Nutrition Life is already doing it, which is what we are in
Okay.
now. That
Okay.
is furtherance of awareness,
Okay.
dissemination of professional information to people.
Yeah.
But believe you me, there is no how you will do it for everybody to see it. Everybody must not
No.
see your own. Everybody must not see the professionals. That's why I believe that in as much as we're supposed to continue propagating what we are doing,
Yeah.
disseminating information and creating awareness, either through social media, through print media, through electronic media and all that,
Mm.
that I personally have issue in social media, in as much as social media can propagate
Reach
this
out
information faster
to more people.
to the target
Mm.
audience. Yes.
Yeah.
The same
Mm.
way it propagates this information or disseminate this information faster to the target audience, it's the same way that wrong information is being dispatched faster
Faster.
to their own
Mm.
target audience. If you go to social
Mm.
media, there are people that their sole aim of being there is not to help
Mm.
people, but to grow their platform, increase their views. So today they are into politics. Tomorrow they are
Mm.
into health. Next tomorrow they are into maybe wellness and fitness.
Mm.
Before they will even find a ground. Anyone that is selling, they go into that side. Now, if this person is somebody who is not a health professional and is trying
Yeah.
to create a health page, a health related
Yeah.
page, what they'll be doing is scavenging other pages. If somebody posts something out there, they will pick it, rearrange it, post it. There are people that are consuming those pieces of information. And
Yeah.
that place where the person is coming from, if there is any error,
Mm-hmm.
he or she doesn't know because it's not a professional in that field. So,
Yeah.
like if you go to Twitter now, there are a whole lot of things going on in nutrition, a whole lot. Sometimes if you counter one or two things, they will talk against you and all that. There are beliefs, non-evidence-based information that people are now trotting out in those places. Okay, so what I'm saying is that we can actually use media actually to propagate this information, which
people should
we are
do
doing
more
now. But people should do more. And again, it doesn't come without some side effects, or let me say some limitations rather, because some people that are not expert in that field are also putting information there. Even in Google, all these things you are seeing on Google, the people that are putting those information are ordinary people. They are not experts in those fields. It's not all of them that are experts in those fields. Normally, people upload information.
One of the ways to gain traffic is clickbait. You just create a controversy, right? Just to make people come and visit your site. Once they visit your site, you're happy, you're making money from it or something like that. So most people go into controversial topics just for people to visit their site and then go and suffer the consequences afterwards. So I think it's one of the things. It's one of the things we need to. So, but before we go, I'd like you to answer. Someone is asking the kind of swallow, they should consume as diabetics. Do you have the ones that you give out? I know that, of course, everybody should visit dietitian, right? Because you're not going to be eating the way you want to eat, right? You're going to eat based on what your body needs. And that's what the dietitian will take care of. It's not about what you're eating, but how you're eating it and the quantity you're taking. Yes. So it's you need to be, very careful about what you're eating, how you're eating it, and the quantity. So this person is asking the swallow, okay, we are taking for instance, what swallow do you usually advise your patients? Because there is this known fact that many people are telling people to be eating unripe plantain, and that is what is the in thing now. People are eating, as diabetic people, they are only eating unripe plantain, and maybe they mix a lot of other things inside the unripe plantain so that they will cut down on their sugar. So what do you really advise people to do?
Well, in this case, there is no stipulated advice I will give here, but I will try a bit. But I will advise that listener that it is better to, if you have a dietitian that you are consulting, assessment will be run on you. By the time you are being assessed, then the dietitian will know what suits you best. Because, for instance, now we know that fiber, we need one of the major things we normally focus on is, apart from the glycemic index, is the fiber. But what if this patient is having some maybe peptic ulcer disease, for instance? You now know that that fiber you have to go a bit, lower than normal. So that's why I say it is better to consult the dietitian so that you be assessed individually. Then the person will now know what to place you on. But I want to say something here. People discourage people from eating gari. I would say this because it's a common food in our environment.
Exactly.
Gari has some moderate fiber, actually, because of the processing method. Gari has some moderate fiber. And if it is white gari, it has lower calorie than the one that is
the red,
the yellow one. Yes, the red one or the yellow one, the one that add oil. So I prefer the white one. Though people argue that because of the cyanide, which actually affect the rhodopsin, maybe for vision and all that. Because of that, they add oil to increase the vitamin A, you know. So which they are frying has actually spoiled some of the vitamin A, actually, depending on how they add the oil. Because in my place, they add the oil in the engine before loading the garri inside jack.
Okay.
While some people
so
add it during
you
frying.
don't lose the.
Yes, some people add it during frying. So if you add it in that engine, it will actually get to the garri itself. You know, get to it very well, so that
really
while frying,
it
not
won't affect the
much direct contact with the frying pan. Unlike where you pour it there, where you are frying, most of it you have direct contact with the frying pan, and you begin to char it and all that. You know, use much smoke. But I want to encourage people that eating garri is okay. The most important thing, you know, what I don't normally like, when people ask you, what should I used to hear this question every day, what should a diabetic person be eating? Let me tell you, if you make mistake and tell this person, eat unripe plantain, for instance, like they used to mention, or eat this, the person will go home and yes, and eat normally the way they used to eat before. So why, in the essence of it, quantification is the most important thing here. Before we talk about other things. So people should eat garri, and I recommend white garri better, because even the vitamin A, unless if you are careless in your consumption, this vitamin A we are talking about, you can get it in many ways. It's not one of those vitamins that somebody.
Not just the garri now.
Not just the garri. So even if the cyanide, of course, the cyanide we're talking about is.
Moreover, the red oil is used in many other foods, not just the garri. You use it in your soup. You use it in your other beans.
Which is even better. It's even much there than in that garri. It's even much than in that garri. And plus that, you can get vitamin A from other sources.
From fruits.
Maybe if you
vegetables.
Eat all these colored fruits. Yes, like all these colored fruits. So if you don't have vitamin A as vitamin A, you must have it as carotene, which is a very simple precursor, for vitamin A. Exactly. So there are other ways to get it. It's not one of those vitamins you can easily, be deficient of. So because of that, I recommend people should eat garri, but even in that garri, it should be quantified. If you don't have your dietitian, at least around 400 grams or thereabout, we do, which you can use your fist. You can use your fist like this to measure at least the quantity. It's not exactly the quantity, but it can give you. It is very close to it. The fist can give you. Or these ones they sell, if you are buying from market already made. That way they wrap it. Although I know that this time that dollar is misbehaving, they may cut the quantity. They may reduce the quantity, or they may maintain the quantity and decrease the price.
I think it will be better. It will be better for them to consult dietitian, but they should just know that garri, there's nothing wrong with garri. That is what you want.
There's nothing wrong. There's nothing wrong with it. That's what I want to say.
So that they won't feel anyhow when they mention garri in their diet. I've noticed a lot of them are always.
I even prefer personally, although I don't have personal problem with wheat, but I prefer garri to wheat. Personally, because garri, we know that garri is just garri. There's no controversial chemical there apart from this cyanide, of which, if it were processed, cyanide would be drastically low. It's just an anti-nutrient, just as there are anti-nutrients in other foods. So preparing that your garri, by the time it is not well processed, because by after milling, it's supposed to allow it 24 to 48 hours, which people don't do because of business. So if you don't allow it like that, to lose those cyanides, and maybe you mill it immediately and dry it, and you want to fry it immediately, so it will retain more cyanides. But if it retains more cyanides, heat cyanide anti-nutrients are heat labile. So as an anti-nutrient now, by the time you are processing, you are preparing, not processing, you are preparing that gari, maybe using your hot water. The rest can be eliminated by heat. You know? If anything is remaining there, it will be very, very, very low, something like that. So that is okay. That is okay.
Okay.
But
any other
I recommend
oats you mentioned oats, right? Initially, oats is also good.
Oat is high in fiber. Oat is high in fiber because fiber is majority of what we are looking at. You know, especially in diabetics. As we are talking about maybe vegetables and all that, people may be, when you are telling them about vegetables, they may just be nodding their heads. But in practical, in preparing foods, you may see that the vegetable is scanty, or it may be drastically low, or maybe this person is using maybe a salad soup to eat the swallow, or using a soup made from cocoyam, which means if you are using 400 grams of, let's say, gari, now you want to eat 400 grams of gari, and you are eating it using a soup made from yam, like a salad soup, or soup made from cocoyam, the calorie you have consumed is not 300 or 400, it's not 400 again. It has increased by the soup. And you know, salad soup doesn't have vegetables now, right? So what it means is that there will be direct entry. Maybe the fiber there, if there is no fiber in the swallow itself now, it means the fiber in the whole thing of consumed. Unlike maybe where you are using okra soup or vegetable soup or any other type of soup that contains enough vegetables. So that's why
same is applicable to people that use more oil.
It's not a one-way.
So
Good. Oil delays absorption of glucose in the GIT.
Saturated.
If you are using, yes, maybe if you eat food that is it may not even be a refined carbohydrate. Just consume food that is very low, or there is no oil. Maybe now yam, white yam, boiled yam. You're eating it like that. No salt. Eat the yam like that. Any glucose that is free from the starch will be more absorbable easily because there is no oil compared to when that yam is eaten with oil. Oil delays absorbability. That's what I'm trying to say. Delays absorbability in the GIT. Yes. So, but that is by the way. So people should consult their dietitian. That's the most important thing here. So your dietitian will guide you. There is nothing I will tell you here that will be other information. That's why I discourage people from getting information online. If you keep on getting information online, yes, there is no such thing. Maybe what you are reading from is talking about diabetes, but your case is diabetes with one complication, maybe hypertension and all that. It cannot go well like that. So when your dietitian assesses you, he may come up, or he or she may come up with an intervention, yes, that will fit you. That's what I'm saying. Thank you. Do we still have time?
Okay. Thank you very, very much. This is a lengthy one. I think we've exhausted our time. And I know that people that will get to watch it later will have a lot of information packed right here. Thank you so much, Dickson. I really appreciate you for coming, and I hope we'll do this, from time to time. Thank you so much. I really appreciate it. Any final words?
Very much. Thank you very much. Final word before I go. Just a repetition of this thing that I've just said now. People should stop browsing their problem online. Even if it is not a nutritional problem, if it's a medical problem, you browse drug, you browse this, you will get confused. You will weigh yourself down. There are a whole lot of pieces of information in that place. And The people
Exactly.
posting or uploading those information are not all professionals. So I am not saying that people should not browse to see information. No, but don't capitalize on that for your healing. See a man
Exactly.
one-on-one, or even if it is online, let it be a professional
Mhm.
that will actually ask you
Yeah.
questions, get one or two pieces of information from you, and know what to,
And
because
they can.
everything is not
Mhm.
offline. I've actually managed a patient
Mhm.
online from Dubai and all that.
Mhm.
So, but you will get information from the person. In as much as I can't weigh the person, I told the man, go and weigh yourself. Give me your weight, give me your height,
Mhm.
then tell me your body frame. Let me know how you are, and all those kind of something. So the person will now know how to
Yeah.
bring
Exactly.
nutrition intervention that will suit you. That's
Intervention.
the most important
Mhm.
thing. Yes. So
Exactly.
stop depending on online information
Okay.
in your health. This is health. This
Okay.
is health. This is life you're talking about, not a gambling. Thank you
Yeah.
very much.
Yeah. All right. Thank you, Dietitian Dixon. This is where we'll call it a day on this year's episode of our World Diabetes Day, which we always celebrate every 14th of November. Thank you for being part of this. And if you're watching the replay, thank you for watching. I'll see you next time. And bye for now. I'll see you on the
Thank you
other
very
side.
much.
Dixon.
All right. All right. Bye.